Hi, I'm Tony Rayburn here at FSCJ. I am a second-term student, and I will be trying to demonstrate a nasogastric tube insertion, and let's get this party started. Alright, first off, I've gathered all my materials. I checked the MAR to make sure that this is what this patient's getting. So I will bring my materials into the room. I will introduce myself. Hi, I'm Tony. Get your name and date to verify, make sure the patient is the correct patient that should receive this. Alright, well, name and date are correct. The patient is alert and oriented. So today we're going to give you a nasogastric tube, well, NG tube as they call them. Have you ever had one of these before? No? Alright, well, it's just going to be a tube because there's some stomach contents that we're going to actually try to remove that cause maybe some indigestion or something like that. So we're going to insert a tube through your nasal cavity down into your stomach. Provide some privacy because it's really loud in here. Alright, so is that okay with you? Any allergies that I need to be aware of? No? Okay. Alright, so I'm going to get started here. I'll just start off by applying some clean gloves. Alright, now I'm going to check the patency of your nostrils, okay? Can I get you to breathe in for me? Alright, other side. Alright. Can I get you to open your mouth and see any problems that may come up? No? Alright, everything's good. I'm going to use this left side here. Is that alright with you? That's fine. Alright? So, next I'm going to measure this tubing, okay? So I'm going to start at your nose, tip of your nose, go around your ear, and come down all the way to your xiphoid process. That way it'll have enough length to get into your stomach. So I will mark this on the hose so I know exactly how far I need to go. Before I get started here, I'm going to get some tape ready for myself. That'll help me out later. That tape is going to be like that. Oh no, not tape. Getting some tape ready to make this a little faster once I get started, because it's a really uncomfortable procedure for the patient, but it's necessary at times. Alright, you ready to get started here? We will lube up the catheter, or lube up the tubing here, the first 4 inches. Alright, I'm going to get you to lean your head back for me, okay? So we will start by inserting in slight twisting motion towards the back. So we can start going, once you get back into the sinus cavity, it'll rotate down for you to the back of the throat. We will check inside the throat with our pin light, see if there's any cooling occurring. Nope, doesn't appear. Alright, I need you to lean forward for me. Alright, this part I'm going to ask you to swallow, okay? You're going to swallow and I'm going to push. Alright, now swallow. Alright, good. Keep swallow. Alright. So we're about to our mark that we set earlier. So we will get this situated. So I'll connect this to the cheek so I can try to check for proper placement real fast. Alright. So we're getting ready here to listen to stomach contents. I have a 60 cc syringe. Put these on correctly. Alright. So remove. I will aspirate. Alright, I got some nice green drainage coming out of here. If policy, I'll check this and I'll check the pH. X-ray can also be used as placement if policy. Alright, so I'm going to instill this back into the stomach while listening. Alright, I hear gurgling, so that's a good sign. Alright, so it appears that the placement is correct. So I will remove this, and we're going to finalize this to your nose here. Sorry, it's not going to be pretty. Alright, so get here. We will disconnect from the cheek here. Now we will, with this tape, we will wrap up the hose. The hose is still at the mark that we measured earlier. So placement is still good. Connect this to the bridge of the nose. All right, next I want to ask you to look to the side for me. All right, as they look to the side, I will then use a pin to attach this to the patient's shirt so that they have enough length of hose so they can move around in normal activity as much as possible. Next I will attach this to the suction that was requested. All right, now I'll ask the patient if anything that they need, personal belongings, possessions, if they have to go to the restroom, anything like that, if they're in any pain. All right, so now I will go take all my stuff, patient's good position, all that kind of stuff. I'll take my stuff, I'll go document the color of the fluid, the pH, the length that I inserted the tubing, that I monitored that it's up to suction. So now 2 hours will pass by. I'll come back to check on the patient. I'll reintroduce myself, ask how they're doing. I will have removed my gloves, wash my hands, and put on new clean gloves. Ask how they're doing, get their date of birth, things like that. I'll also, while I'm here, check the oral cavity because they're not taking anything in by their mouth. And I will do oral hygiene if necessary. Again, to check placement, I'll ask them to speak and things like that to make sure the vocal cords aren't being messed with while it's in there. Again, I'm going to check the aspirant. I see that there some 150 mils has been taken out. All right, so now I will again aspirate. All right, some nice green fluid still. It's easily taken in the tube. All right, I'm going to do the same thing I did earlier. I'm going to instill this back in while I listen. All right, right on the stomach. Instilling some whooshing, some gurgling sounds. So that's good. All right. You still doing all right? All right, this next one's going to be a little weird, all right? So now I have a normal saline solution that I'm going to use. I will withdraw 30 milliliters of normal saline. And then I'm going to instill this. So this is going to fill up your stomach, and then I'm going to take it out, okay? So this might feel a little weird. So I instill the 30 milliliters. And now I'm going to withdraw as much fluid as possible. All right, so I'm withdrawing 35 milliliters. It's mostly clear, but there is some green and different, some occluded colors in there. So I am going to make sure I can disregard that. I will hook them back up to the suction that they were already introduced. I will ask them if they're in any pain. If so, I will, if they have some PRN meds, things like that, I will give them to them. I will see if there's position, if they want to move the head down or up, their personal belongings, and then if they have to use the restroom. Again, I'll take all my belongings out of the way. I will go document the amount that I removed, how the patient is tolerating the procedure, the color, the contents, things like that. And I believe that is all for today.